Implemented in 2010, the RIS and PACS have changed the way clinicians access and read diagnostic images, such as CT scans, MRIs, and X-rays. Dr. Blake McClarty was an executive sponsor of the RIS and PACS project.
Historically, neurosurgery, say, is based at the Health Science Center. If they wanted to view the images that as a preoperative measure or to assess a patient, they would have to have the images sent over by courier or mail in order to view them. Now it's just done electronically instantly. It also helps us in our productivity in terms of our workflow and management, that they give a work list from the RIS system, the radiology information system, directly into the modality, the CT scanner or the radiography unit. The list includes the patient's demographic information and health and identification numbers and so on. So there's no errors with data input, and the technologists can spend their time doing the examination, looking after the patient instead of having to put in all of that data into the CT scanner. Also, the PACS system allows us to convert to a digital environment in terms of the acquisition of the images. So in the case of plain radiography, we can do digital radiography where the images, instead of being on traditional film, are now on plates and are converted instantly into a digital image and instantly sent to PACS. We can search whether the patient has had examinations in other locations in the province, so that if somebody's had an examination in Dauphin, it's all available to us for comparison when they're transferred down here with, say, a cardiac condition or something. Our turnaround time is much improved too with PACS because the images are available, and if those ones, in the past, if the film were in emergency, we wouldn't be able to interpret them formally because the emergency doc was doing it. We might see something that the emergency doctor missed, and now because the images are available to us at the same time, we're quicker in terms of getting the reports to emergency and so on. And the RIS is fantastic for that because the actual typed report, even before we sign off and sign on it, is available to the physicians as a preliminary report as soon as it's typed. And that can be within minutes of the examination being completed. The thought of going back and interpreting on the basis of films, none of us would want that. It's been a remarkable increase in time. The transition's been, of course, a little bit difficult, but no one would vote to go back and remove the PACS system and go back to the way we were doing it. It's just not even, it's been a remarkable change in the way we practice, for sure.